I am Dr. Rajendra Gujjalanavar, Senior Consultant and Head of the Department of Plastic Surgery at Sakra World Hospital. Today I am going to talk about a coronal craniosynostosis. What is this coronal craniosynostosis? This is an early fusion of the coronal suture of the skull. As we see in this skull, there are various sutures which are gaps in the skull which helps in expansion of the brain and the skull fuses early than the normal. The coronal suture is on the side of the skull, starts from the ear and ends at the top. There are two, one is on the right side, one is on the left side. When usually this fuses at the adult age, but when it fuses by birth, it causes a coronal craniosynostosis. What it causes? It causes a restriction of the growth of the brain on one side. Because of that, brain start growing on the other side, and as a result it causes a flattening on one side of the face, and also it has an effect on the brain, and this may cause a learning and speech disabilities at a later date. What is the treatment for this? So treatment is basically depends on the age at which the child presents. If the child comes between 2 to 6 months of age, we offer them minimally invasive endoscopic strip craniectomy, in which we, with a small cut on the scalp, we make a small cut and we remove the part of a fused suture, complete suture, using a endoscopic. This is followed by the helmet therapy, which helps in reshaping the skull bone. So this way we can give a minimally invasive smaller procedure which has a good recovery or quicker recovery for the child. But if a child present after 6 months of age, this we cannot do for that child because the bones have become little harder. In such case, what we do is open surgery, fronto-orbital advancement and cranial remodeling, in which we take out the whole of the front of the bone, remove it from separate it from the brain, remodel it and fix it back. In this way, we can give a good normal shape, and also it helps in a normal growth of the brain, and child grows normally. And this is a multidisciplinary team approach where various departmental doctors are involved, like a plastic surgeon, craniofacial surgeon, a neurosurgeon, pediatric surgery, and a pediatrician and other specialists who look after the child throughout the development of the brain. Thank you.